Rhinoplasty is done with very different techniques depending on how you're trained and also depending on the patient's nose. That's where the training is so important, to be able to customize your technique and your approach based on the shape of the nose and the problems involved. Typically, it's either a closed approach or an open approach, and mostly I do an open approach. I feel that I can really specifically address each tiny little nuance within the nose that I encounter, and I'm able to see it, diagnose it, and treat it without having to go through essentially a blind tunnel to do it. So rhinoplasty typically takes anywhere from an hour to 6 hours, something that's just a simple re-breaking of the nose to put it back in the middle if it were broken previously. It can be quick. If you are doing something where there is scarring or there's been several previous procedures, then you sometimes have to take more time to use grafts from the rib, from the ears. So the average is about 3, but it can take anywhere from 5 or even 6 hours in a more complicated case. Because the face is so well vascularized, bleeding is usually the main thing we think about, and we take a lot of measures beforehand to try to reduce the risk of bleeding. Other than that, it's really, as long as a patient is following the protocol and the procedures afterwards, the risks are few and far between. So the results early on can be a little bit swollen and not exactly where it's going to be, but over time you'll get the result that you will be expecting in about a couple weeks, and then 6 weeks for sure you'll start to see it taking shape. 6 months you're about 90% there, and then a year you're 100% there. You see it on social media all the time, but the reveal when you take the splint off is really dramatic, and to see someone get really emotional, even have tears of joy, is really exciting, to see somebody have that kind of response. I would tell the patient who's considering a rhinoplasty that it is a very complicated procedure, and in the right hands with somebody who has extensive training and experience, it can be one of the most gratifying procedures.